For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. With the holidays coming up, everyone's worried about staying healthy, whether mentally or physically, or taking care of your children. So today we have 2 guests here today to talk about staying healthy for yourself and for your children. Our first guest is Dr. Robert Fauché. Welcome, Dr. Fauché.
Thank you, Amanda. I'm glad to be here.
Can you tell us a little bit about yourself and your background?
Absolutely. You know, I trained out of LSU, both undergrad medical schools and as well as residency out of New Orleans. So we did Children's Hospital and University Hospital as our residencies primarily. Did an extra year as chief resident of pediatrics before coming out. Been in practice now for close to 20 years between South Shore and North Shore, most of which has been on the North Shore.
Okay, great. So with the holidays coming up, that also means flu season.
Right.
Can you tell us a little bit about the flu and some of the symptoms? Yeah,
absolutely. Flu is, exactly what you would think it would be. Everybody's had it, unfortunately, at one point or another in their lives. And so you're looking at high fevers, muscle aches, a lot of times sore throat, headaches, rarely or not so rarely diarrhea, vomiting, that kind of thing. But usually when you have it, you know it.
Okay. And so I think a big thing with the flu is spreading it. It's very contagious. Can you talk a little bit about how someone can spread it and then how long someone can spread the flu?
Yeah, the thing about the flu is, unfortunately, when you contract it, you are contagious about 24 hours before you even know you have it. So it's kind of one of those things that it obviously knows what it's doing, because it obviously wants to spread from person to person, and what a better way to spread than when you're not even aware you have it. But once you start having your symptoms, you're looking at about 7 days or so of viral shedding from the time that you start getting sick to the time that maybe you start feeling better and that fever goes down. So it's respiratory droplets primarily, so close contact with others if they cough or sneeze in your general direction. Sometimes maybe what we would call fomite contact, which is basically if someone were to sneeze on the table and you put your hand there accidentally, that kind of thing. That's not as common. It's primarily more respiratory and cough, sneeze kind of transmission.
Okay, and so as a pediatrician, I'm sure you mostly deal with kids, and they get the flu, spreads easily. I'm sure they're not great at covering their mouths.
Right.
So with school, how long do they need to be out of school? I'm sure that's one of parents' biggest concerns, is keeping their kid out of school.
It's usually, what we usually say in the office is fever-free 24 hours. So once you get sick, if you're having that fever, you wait for them to defervesce and then count 24 hours from that last fever. And then they can usually go back, assuming that their energy level is adequate, their appetite is back, those types of things. Because if you send them back too soon and they're really not ready, they're going to call you from school and have them come pick them up. So usually the 24-hour fever-free rule is the one we go with.
Okay, and can you talk a little bit about the flu in general, what the kids will experience, and kind of, what the parents can expect while their kid has the flu? I know it's kind of different for everybody, but...
It is. Most of the time when they come to the office, I can walk in a room and almost see right away that that's what they have, because you'll notice a lot of lethargy. They'll be laying on the table, usually with a blanket up to their neck. They may have chills. The mom usually will say, we've had fevers up to 102, 103, maybe 104 at times. So the fever is usually the giveaway. Not all kids have that, but certainly we've had milder cases where maybe they just come in with a sore throat or some cold symptoms. But that's usually what you can expect. They just won't seem themselves, and you'll start getting this high fever, and that'll be a clue as to just give us a call and let us take a look.
Okay, and is there a treatment? Is it something you can take antibiotics for, or is it just got to ride it out?
No, unfortunately, it's a viral illness, so antibiotics are not going to work. Now, some people may have been to their doctor and been diagnosed with the flu and received antibiotics, but that's usually because viruses in general, but the flu in particular, likes to set you up for secondary infection. So while you have the flu, it's still possible to develop an ear infection, or it's still possible to develop a bronchitis or something like that. So if when you are evaluated by your physician, they think, yeah, you have the flu, but there's also some other underlying illness, you may receive an antibiotic for that. If you came in with just the flu, however, there is a medication called Tamiflu, which is often used to try to shorten the course of the illness. That medicine is usually best used within the first 48 hours of the illness beginning. So if you feel your child is starting to spike fevers, or that they may have the flu, they were in contact with somebody with it, and you suspect that, call your pediatrician's office as soon as possible, because the sooner we can test them and verify that that's what it is, the sooner we can start them on the medicine, and it usually does shorten the course of the illness fairly well.
Okay, and how can parents protect their kids against the flu?
We always say hand washing, which is probably for kids the most difficult thing. You don't see too many kids washing their hands like they should. So that's really the biggest thing. It is very difficult because of the mode of transmission as far as the coughing and the sneezing, and the kids, especially in the daycares, close contact, mouth and toys to prevent that. But hand washing and just commonsensical type stuff. If you have an opportunity to go to a birthday party and you walk in and you can tell just by looking around, there's a lot of kids with runny noses and coughing and sneezing. If you're concerned or you're planning a trip or you're about to go out of town for the holidays, it's probably best to just excuse yourself and get out of there if at all possible.
Right. Okay. And then I guess, can you talk a little bit about the flu vaccine?
Sure.
That's a big topic all the time, I think.
Yeah, the flu vaccine, a lot of people are concerned about vaccines in general, but the flu vaccine is one of those that is very well studied. It changes every year based on what they anticipate the most common strains will be. This year we're seeing mostly type A. There is some type B out there. Unfortunately, the way the vaccine was constructed this year, it does cover that type A. So we're anticipating, although we haven't seen it yet, as far as you can never tell, you got to wait for it to kind of play out a little bit, but we're anticipating to have pretty good coverage this year. So some people out there feel that, back in 2014, I think it was, the vaccine didn't match very well. So I think that maybe 1% of those that were vaccinated received some benefit from the vaccine. It was really poor that year. They've kind of hung on to that as a reason not to get the flu vaccine. It doesn't work. It's not going to match up. That's really not true. If you look at the cumulative data from, say, back to 2010, it was probably a 77% or so coverage rate that was successful. So at least this year, what it's looking like is if you get the flu vaccine, you're cutting your chances of getting the flu at least in half. Okay. It's not a preservative-containing vaccine in most cases. It's not a live vaccine, so it's not going to make you sick, not give you the flu. So.
Okay, great. Well, thank you so much.
You're very welcome.
We will be right back with Dr. Fauché to talk a little bit about RSV.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. We're back with Dr. Rob Fauché here to talk a little bit about RSV. Welcome back, Dr. Fauché.
Thank you, Amanda.
So I guess first, can you tell us what RSV is?
It stands for respiratory syncytial virus. It's an upper respiratory tract virus that can give you both what we call upper respiratory symptoms, which is usually your runny noses and your sneezing and coughing, and your lower tract illness, which can sometimes lead to wheezing and even more coughing, shortness of breath in younger kids.
Okay, and so you kind of mentioned some of the symptoms. Is it something that I feel like it's a little less common than the flu, and maybe something parents don't notice as much?
Actually, in the world of pediatrics, it's the season we probably dread the most. It happens every season, usually between late October, early November into the latter part sometimes of February, March, that kind of thing. And for kids, it probably isn't as noticeable with adults, because when adults get RSV, which they can do, it's usually just a head cold is what people refer to it as, just a common cold as far as symptoms are concerned. But in the younger kids, because their airways are smaller and because the virus tends to produce a ton of mucus that can clog up their airways in certain places, it can lead to wheezing, shortness of breath, and sometimes hospitalization.
Oh wow, that's what I was going to ask. It sounds like it's much worse when it's in children.
It can be, you know, because of their anatomy and that their airways, you know, those little tubes that pass the air back and forth are relatively small compared to adults. So they're easier to clog up. And when that starts to happen, you start to have a little bit more difficulty with breathing and wheezing and stuff like that. So thankfully nowadays, you know, we've learned more about it and kind of adapted to the symptoms that it presents with as far as our treatments are concerned, and that has helped prevent a lot of kids from having to be hospitalized, but occasionally you still have to do that.
Okay. And is there a vaccine similar to the flu that you can get to prevent RSV?
You know, they haven't come up with one yet, and the reason is because RSV doesn't give you a ton of prolonged immunity when you get it. So it is very possible, for instance, for a child to get RSV twice or even more in the same season. So it's unfortunately not like a chicken pox or a mononucleosis where you'd get it one time and you're good for your lifetime. So that has been a problem in giving a one-time hit of a vaccine because the immunity just isn't worth it. It doesn't last as long. However, they have developed what we call a monoclonal antibody. It's called Synagis, and for very specific children who have maybe underlying health disease like you know, perhaps a congenital heart disease or underlying lung disease, they can receive it. It comes as an injection. It's once a month, and it's actually just antibodies that are already primed to fight the virus. So you don't have to build an immune response to it. You're essentially given an immune response that fights the virus for you.
Gotcha. And is that because they already have issues to protect them from it?
Yeah, it is, and it's a very expensive therapy, and so the AAP has really come out with some stringent guidelines on when it can be used. So it certainly isn't for the vast majority of patients who come in. The vast majority who come in with RSV, we're going to manage those kids just symptomatically, and they will tend to get better on their own within 5 to 7 days.
Okay. Are antibiotics useful when treating RSV?
No, unfortunately not. You know, RSV does like to cause ear infection, and so sometimes when a pediatrician looks in the ear and sees that it's infected, it's very hard for us to tell, knowing that a child has RSV at the time, is this a viral ear infection or is this a bacterial ear infection? So at times like that, you may receive an antibiotic just to make sure that, if it is bacterial, you're treating it appropriately. But in most cases, you're not going to need that because it's all viral symptomatology. So when the virus goes away on its own, just like with the flu, you're going to get better.
Okay. And so what is the treatment for RSV?
It's usually supportive care. You know, back in the day, not too long ago, certainly when I was a resident, we used to hit these kids with a bunch of breathing treatments and steroids and all this kind of stuff, similar to what you would treat an asthmatic with. Since that time, they've looked at, do those therapies improve those children as far as getting them better quicker or preventing them from being hospitalized, or even when they're in the hospital, does it help them to get out of the hospital faster? And the answer has been universally no. And so certainly steroids are something we've kind of moved away from. Occasionally we'll give some kids breathing treatments, especially if we give it to them in the office and it seems to help them. We may send them home on that, but it's basically just, controlling the secretions, getting the mucus out the nose as best you can and just watching their respiratory status.
Okay. And are there side effects of RSV, like after kids have it?
It's debatable. For the longest time, and they haven't really definitively proven this yet, but we certainly see it, I think, clinically. Once a child gets RSV, and probably almost 100% of kids by the age of 2 years will have had RSV at some point in their lives, when the body heals from that, there's believed to be a process the lungs go through called remodeling. And it's basically just almost an over-exuberant healing process that takes place. And so what that leads to is once those lungs are repaired, and sometimes maybe repaired a little too well, as they go on to get subsequent illnesses such as colds and that type of thing, they may be more predisposed to wheezing. Thankfully, however, as they get older and farther removed from having had that RSV infection, that tends to lessen. So every time they get a cold, they're not as likely to wheeze. But some kids who have quote unquote outgrown asthma really have had just an RSV infection that has led them to wheeze with illnesses, and that's why they outgrow it.
Okay. And I guess the final thing is, what should be done if a toddler comes in contact with someone that has RSV?
I think you basically just watch them. Some kids, depending on their age and their underlying medical history and that type of thing, they're going to handle it just fine. They may not even get a fever. They may get a little runny nose or congestion. The big thing I tell my patients to watch for is, excessive coughing, shortness of breath, wheezing if you can hear that. If you notice that they're kind of working to breathe a little bit harder, their abdomen's being sucked in and out, you might see some retractions, which is just kind of the skin between the ribs being sucked in as they try to breathe a little bit harder. If you guys see that, then you need to call our office and let us know, and we can take a listen to them and see how they are at that point in time, and if we need to do anything different than what we're doing.
Okay, great. Well, thank you so much. I think this was
pleasure.
great for parents, especially getting into this season.
Absolutely. Thank you for the time, Amanda.
Thank you. I'd like to thank Dr. Fauché for being here, and up next we'll have Renee Ridgely, a social worker from our parenting center, to talk a little bit about the stress of dealing with the holidays.
Thank you. Thanks. Thank you. Thanks for Sunny Face Eggs for my baby sister.
For my fishing buddy.
Thanks for my mama's gumbo. Thanks for my mom.
We enjoy receiving awards and recognition from our peers, but the true reward comes from seeing positive outcomes for our friends and neighbors. So thank you for trusting us. St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Up next, we have Renee Ridgely, a social worker from the St. Tammany Parish Hospital Parenting Center. Welcome, Renee.
Good morning.
So I know you're here to talk about stress, which I'm sure the topics that we talked with previously with Dr. Fauché can cause parents a lot of stress during the holidays. So I guess first, you mentioned earlier to me that there was a thing called good stress, and I thought you could talk about that first.
Oh, well, good morning. Yes, there is a thing called good stress, and it's a normal part of our life. Good stress is like when you're having a baby or buying a new home, getting married, planning an event, maybe more like a holiday event. And having a holiday event, you stress out because you're trying to get it all perfect. But it's good stress because it's energizing and you're excited to do it, but you kind of overindulge and it gives you some stress, but it's good stress because you're excited.
Okay.
Yeah.
So it's maybe not good for you, but it's good.
It's good stress.
Good stress.
It's happy stress because you're doing some wonderful things and you want it to be perfect and it's going to make your life better. But sometimes we overindulge and it causes us to have the bad stress.
All right. Well, I guess next we're going to talk about bad stress.
Yes.
But with the holidays coming up, what can cause holiday stress?
Shopping crowds, family drama, just staying out too late, hauling the kids all around. The kids tired, don't want to really shop anymore. But mostly, holiday stress is being financially strapped. Not having enough money to do the things that you need to do, to buy the gifts that you want to buy, and you just financially tap out. You just can't do it. And with that, I always tell my moms and parents that come in is that set a budget, bargain shop. If anything, don't overindulge. Set limits. I mean, I am a person that shop during off season. Try to plan ahead of time so your finances won't cause you stress. But that's the biggest stressor during the holiday season is not having enough money.
Gotcha.
Yeah.
And so I guess, like you said, you mentioned budgeting and things like that. Those are ways to avoid having that stress.
Avoid having that stress. I always say, don't break the bank for one day.
Right.
Don't break the bank for one day.
That's good. I think sometimes people get wrapped up in presents and things like that when that's not the most important thing.
And especially if you have that only child, I'm guilty of that. You just indulge buying stuff and then come the next day, you just simply don't have any more money because you've brought all these wonderful gifts.
Right. Okay. Well, earlier you talked about good stress from being excited at the holidays. Can you talk a little bit about how to avoid feeling overwhelmed during the holidays?
You have to realize that you simply cannot do it all. You can't do it all. It's a great time to enlist friends, get someone to help you, ask someone to bring a dish, ask your guests to bring a dish, pick up a dish. And that also will help alleviate costs as well from your own personal expense if everybody just bring like a dish or something. You want you want to get everybody involved. It's fun when everybody is involved. If you take on all the responsibility, it will stress you out because you want, we want things a certain way. It has to be perfect. The lights don't go this way. Don't put it that way. But you cannot do it all. The moment you realize that you're doing too much is when you are stressed.
Right.
Yeah.
And I think that's probably good advice for all of life.
Yes.
Is know that you can't do it all.
You can't do it.
Okay, so what are some things that someone can do to reduce the stress once they have it?
As I say to my little kids when they're bad, take a time out. Take a break. Sit back and refocus. Let your mind relax. Go jogging, exercise, just break away from what you're doing because that's causing you stress. One of the things I recommend is just like, go take a good sip of tea, indulge the aroma, drink you some coffee, add you some honey, and while you're drinking your tea, embrace the peace. Let your mind just relax and flow with the aroma of the tea and just enjoy that me time without thinking about, I gotta go to the grocery store, I gotta get this, I gotta get that, I gotta go. No Christmas cards at them particular 10 minutes. Just relax, enjoy. Let your energy get back up and change your mood to happy.
Okay, and that's what I was gonna ask. Do you have like a time limit? I'm sure some people don't feel like they have time to take a minute to themselves.
10 minutes can reboost you. But I think like after your day is over, you're about to go to bed, just reflect. Take that time to reflect, take a bubble bath, do what you need to do to get your mind in that place to give you more energy to continue to enjoy that good stress of planning and enjoying the holidays.
Okay, and then what do you have recommendations for people who maybe want to do things that they shouldn't because they either don't have time or they don't have the money, but they think they're required to have a party or do things like that? Do you have, coping mechanisms or ways for them to maybe say no?
Right. One of the things that I truly recommend is that you just host it somewhere else. Don't host it at your home. You don't have to cancel the party. If you just can't simply do it at home, host it at a restaurant. That'll take away you cleaning up, having food, or host it at an event hall. For Thanksgiving, my family, we're in an event hall, and everybody has to bring an item they put in. Everybody put in for the hall. Everybody has to bring an item, a food item, or a decoration, whatever they assign you to. And the best part about that, nobody have to worry about cleaning up. Nobody have to worry about setting up. It actually help you enjoy being with your family and friends because you don't have to worry about, it's your turn to clean up. You got to wash the dishes. Thank y'all for coming. It's time to leave, but just try to find a way to cut down your own stress. So.
All right. Well, any other final ideas about getting rid of stress during the holidays?
My favorite is I say, think about your kids, your family, but most importantly, I say, turn up the music. Put on you some holiday music and let your mood change and get into festivities and just look forward to engaging with friends, partying, Christmas lights, but put on your music, your favorite Christmas music. Get in the spirit. It'll definitely reduce your stress, but help you to enjoy what you're doing because you're going to have some stress. But music actually helps. Turn on your tunes, enjoy your time, and just try to not focus on all you have to do, but just enjoy the company and the festivities.
Great. Well, thank you so much.
You are welcome.
I'd like to thank Dr. Fauché and Renee for being here and talking to us a little bit about mental and physical health throughout the holidays. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.